So your question really is, how do we identify reflux, how do we identify symptomatic reflux, and how do we approach the well child with reflux? And of course the big challenge here, which I'm going to address, is how do you identify symptomatic reflux from physiologic normal reflux, which occurs commonly in babies, in healthy babies, in form of premature babies, and really that's one of the challenges we have. So there's several treatment options. Probably the best treatment option is none at all, but certainly there are pharmacologic approaches which I'm going to address, although they do carry potential side effects. There's thickening feeds, there's positioning babies, so there's several ways we can go about this dilemma. So the question relates to what's the optimal medication for reflux, and I think there's increasing reservation about unnecessarily using medications in babies. So I think that would be the first point I'd like to make. As far as the medications are concerned, there's two categories. There's medications that will decrease acidity of the reflux aid, and there's medications that will enhance motility of the gastrointestinal tract to sort of move things through. And I think that based on some of the diagnostic studies that are available, that I will discuss a little bit, we may be able to have a slightly more focused approach to treatment. But keep in mind that gastric acidity might be beneficial in terms of protecting the baby against infection. So we should think twice before we just eliminate all acidity. So you ask about positioning recommendations and whether there's any conflict here with the Back to Sleep campaign to prevent SIDS, and there really isn't. Point number one and the most foremost issue here is that we need to avoid placing babies on their tummy. We need to lie them supine. There really is no, while there's always the concern if a baby is on his or her back that they might be more likely to reflux, I think there's really no hard evidence that that's a problem. So first and foremost, we must acknowledge the Back to Sleep campaign. There are some positioning recommendations on the side which we can address a little bit, but I would not put a baby on his or her tummy during that critical period when you're at risk of SIDS, even if you think there's a problem with reflux. So the question really relates to what do different subspecialists advise. For example, neonatologists, pulmonologists, gastroenterologists regarding the management of reflux. And there are differences of opinion, and we're going to play with that during my presentation because I think that's sort of a fun issue to think about. Basically, the pulmonologists, this pediatric ENT people really attribute a lot of respiratory symptoms to reflux. The gastroenterologists and the neonatologists less so. So I think this is sort of a fun thing to talk about and get a sense for what recommendations we should consider.